joining VCU Libraries today for our Communicating COVID panel discussion. I am Dana Ladd, an associate professor at VCU Libraries, and I am the Health and Wellness Librarian at the VCU Medical Center Health and Wellness Library. I want to also introduce you to my co-moderator, Oscar Keys. Oscar is the Multimedia Teaching and Learning Librarian at VCU Libraries. Keys is working hard behind the scenes, making sure everything runs smoothly today so that you can view our panel discussion. So thank you so much, Keys, for helping make this possible. Also, I want to thank our panelists for agreeing to participate today in this very important conversation. Before we get started with the discussion, I want to introduce you to our four panelists. So welcome to Natalie Pennywell. Ms. Pennywell received her Bachelor of Science degree in Biology and Chemistry from Voorhees College in 2006, and her Master of Public Health and Health Promotion, Education and Behavior from the University of South Carolina in 2010. She holds certifications as a Certified Health Education Specialist and a Consumer Health Information Specialist. She currently works at Virginia Commonwealth University as the director for the VCU Health Hub at 25th in the East End of Richmond, Virginia. As the director, she provides operational and programmatic oversight to the inaugural Health Education and Wellness Center. In order to deepen and accelerate VCU and VCU Health Systems' work in promoting health equity and addressing the social determinants of health, she works collaboratively to help lead the planning, launch the operation of the Health Hub. She previously worked as the Community Outreach Coordinator for the Division of Community Nutrition and as Community Health Educator in the Crater Health District within the Virginia Department of Health. Ms. Pennywell is a member of several professional and nonprofit organizations to include the Virginia Health Catalyst, Greater Richmond American Heart Association, the Links Incorporated, and Delta Sigma Theta Sorority Incorporated. She works hand in hand with community neighbors, stakeholders, organizations, and agencies to address social needs that include safety, love, and belonging, cultivating agency, and developing healthy power exchanges that uplift and tangibly improve the quality of life for all. Next, I'd like to welcome and introduce Dr. Antonio Villa. Dr. Villa is a primary care physician who has more than 15 years of experience in the clinical and public health practice in Mexico and Colombia. He completed his Master of Public Health and Management at Virginia Commonwealth University. In 2010, Dr. Villa founded La Casa de la Salud as a nonprofit organization to contribute to the health improvement and well-being of the Hispanic community in the Central Virginia area. At La Casa, he has been able to establish a relationship with diverse professional collaborators, community health workers, and community leaders, as well as with different Virginia Health Department districts, safety net clinics, and other private organizations. Okay. He has been working with partner organizations and health professionals in the community, conducting community engagement to address the needs and social factors that affect the health and well-being of the Hispanic community. Dr. Villa is also an adjunct professor at the Health Science and Kinesiology Department at VCU since 2015, guiding his students in the importance of preventive medicine while facilitating their practice in the community. Next, I'd like to introduce Dr. Janine Guidry. Originally from the Netherlands, Dr. Janine Guidry is an assistant professor at VCU, Richardson T. Robertson School of Media and Culture, as well as the director of the Media+Health Lab. She received her Ph.D. in Social and Behavioral Sciences from the Department of Health, Behavior, and Policy in the School of Medicine at VCU. her MS in Health Sciences from Maastricht University in the Netherlands, and her MPS in Strategic Public Relations from George Washington University. Her research agenda focuses on the use of visual social media in health, risk, and crisis communication, with a special focus on infectious diseases and vaccines. Several of her recent projects have focused on the Ebola and Zika outbreaks, the flu vaccine, the measles vaccine, and the HPV vaccine. Her work has been published in Emerging Infectious Diseases, American Journal of Public Health, Vaccine, Scientists, and Health Communication, among others. And last but not least, I'd like to introduce Tamera Langhorne. As a community health worker, Ms. Langhorne advocates for community change through participation in city and statewide initiatives. In addition, she serves as a community connection point for convening community residents around public health programs, research interventions, and community assessments. Some of her duties include developing and adapting approaches to problems that take into account cultural differences, as well as identifying the role of cultural, social, and behavioral factors in determining the delivery of public health services. And most importantly, Ms. Langhorne helps strengthen communities by helping residents connect to medical and social resources, learn about their health, and speak out for positive change. So again, I want to thank our panelists so much for participating today, and thank you all for joining us. We will go ahead and get started with our questions and discussions. And I first want to talk a little bit more. I know I introduced each of you, but I want to talk a little bit more about what you do in the community. As for myself, like I said, I'm the health and wellness librarian, work at the Health and Wellness Library, and we provide reliable health information to patients, their family members, and the community. And we offer regular health and wellness programming and outreach to the local community. So we provide information if people are newly diagnosed with diabetes, help them find information about that, or any type of healthy lifestyle changes, or if they're having a surgery, we help them find information to help them learn more about what to expect. And we help them with information written in a level that the layperson can understand. So that's a little bit about what I do, but I want to find out a little bit more about our panelists. So tell me about your organization, the organization you work for, and describe the health outreach, or in Janine's case, the research that you're doing for our community.
Well, I can jump in. Me and Tamera is a package deal since we work together. Um, the VCU Health Hub at 25th, as you named in my bio, is a health education and wellness center. It has been open since May of 2019. It's fairly new. We're excited to work collaboratively with our neighbors to really leverage the assets that are internal to the VCU family that exist on both the university side and the health system side. What that means is we are able to offer programmatic opportunities for people to change some of those things that they would like to from a health behavior standpoint. We also work with our community members in order to address those social determinants of needs, that buzzword we often hear, that affect where people live, work, grow, age, worship, and just develop community family. And so for us here at the Health Hub, it's really imperative and important that we uplift community voice in a way that's quite not only tangible, but it's seen throughout and woven into the programmatic opportunities that exist within the Health Hub. And so we're hoping that over time, the Health Hub is not just here to create programming, but to also create an opportunity for the next wave of professionals to learn how to do this kind of work in an authentic and genuine way. That's why we also have faculty, staff, and student development that operates and takes place in this space so that they can contribute to the body of work that is necessary, not only for them as a generation, but for their children to come in order to make sure that our community members have what they need in order to be successful and have a wonderful quality of life. So from there, I'll pitch it over to Tamera to add anything else that she may like regarding the Health Hub and what it does.
For the most part, Natalie covered everything. I would say, as far as like my role specifically, I connect with community residents and basically meet them where they're at. So I connect with them in their neighborhood whether that be at the local libraries, the grocery stores, the corner stores, wherever they at. I meet them where they're at, provide outreach and just basically peer support and navigation and answer any questions that they need and navigate them to the proper resources to live a better life.
Great. Thanks, Natalie and Tamera, for letting us know a little bit more about what you do at the Health Hub. Antonia, would you like to tell us a little bit about La Casa?
Thank you. Thank you, Dina. We launched La Casa de la Salud in 2014, while Mexican Consulate has an event in the city of Petersburg. That initiative started growing with different volunteer collaborators, as well as other organizations that see the opportunity to engage the community in their programs. The community health workers are people from the community. They live in the community. We start with a few community health workers by that time, facilitating health services, clinical preventive services. We used to do screening, high blood pressure screening, glucose screening in the community, in health fairs, church events, some event that we planned at the La Casa de la Salud in different areas in the Richmond area after 2014. We start working also in a specific public health program for those top priority that the state has in the Hispanic community. Diabetes prevention, cardiovascular disease was one of the priorities that we are still very focused on, in addition to facilitate access and for the services that people are at risk, or bring those people at risk in our programs that we have with the health department. In the beginning, as I mentioned, in the city of Petersburg, but we expand that services in the city of Richmond. We used to work with consulates, Mexican consulate, Salvadorian, Guatemala consulate that have a big number of people. We have been doing screening and provide educational materials, create awareness in those activities. In the last 2 years, we have been growing. We have a group of 30 community health workers in a connected through WhatsApp group. Last year, we had continued education for those community health workers that most of them were as volunteer for their community. Some of them belong to some churches and help their friends, their family in the community, facilitating basically health services. And we provide education material to them to facilitate other needs that they have. Today, that we are more focused on other social issues, we are training those community health workers to facilitate those to facilitate resources or services that they need. At this time that we are living a very difficult time, we have a phone line that we connect those community health workers to our phone line. With other organizations, as you mentioned, Dina, we have been working with Health District. We have been working with other safety net clinic for a specific project, as well as other private organizations that willing to provide services or any resource that they have available for the Hispanic community.
I think I'm the only one left on the panel. So my name is Janine Guidry, and I work in at the Robertson School at VCU. And my focus of research, particularly, because I think that's one of the more interesting things of my job in this setting, I focus on digital media, social media, everything that's happening online, which of course has dramatically increased, including things that happen on smartphones. Um, and I focus on that and misinformation, health communication, particularly related to infectious diseases, and not exclusively, also done some work on mental health, um, violence prevention. And to me, those areas, they overlap into each other. We're seeing that even with COVID. We're seeing with COVID that obviously it's a very infectious disease. We're dealing with the development of a vaccine, with other preventative measures. We're also dealing with increased issues with mental health, people who um, are finding this a hard time to go through. And I think that's all of us. This is a time of great uncertainty. We've seen issues with increased violence, especially domestic and intimate partner violence, in this time of COVID. So what I do and what my team at the Media and Health Lab does is we work on, first of all, listening to what people say online. What are people saying in this time when they're spending more time at home, the majority of people? What are they saying and what are they processing? What are their fears? What are their concerns? And then in addition, how can we best use these digital platforms to, and these apps to communicate in a responsible way with people? How can we provide the information that they need? This is a tremendous time of uncertainty for all of us. I think that when our communities sort of shut down to a degree in March, no one really had an idea of how long this was going to take. And so we're looking at how can you best use that? What are the problems with digital communication? What are the strengths of it? And how can we best help people utilize them for good? And how does that play a role in today's environment? And how does that play a role in the midst of a pandemic? Um, so we look at all those kind of items. We look at different parts of the population, different platforms, and in reality, it's all about communication. And I think that plays a role for all of us. How do we communicate as healthcare providers, as researchers, as scientists, as community health workers? How do we best communicate with people? And I think those principles are things that can help all of us. So that's a bit of the focus that I do.
Great. Thanks so much, Janine. And thank you all for giving us a little bit more of an overview of what you do. And thank you so much for all the work that you do in our communities to make people healthier. And I know COVID has really impacted the communities that we serve. So I would like for you next to talk to us about some ways that COVID has impacted the community outreach in the community that you serve.
I'll jump in. So one of the things that I think we've seen, and I don't work as much with one single community, but I focus on the online community and the online communication, is I think I do think that this feeling of uncertainty, this how long is this going to take? When can I see my grandparents again? Can my kids go to school? Are they safe if they go to school? Is there medication if I get COVID? Is there a true treatment for COVID? Is there going to be a vaccine? Is that vaccine going to be safe? I think all these things play into a sense of uncertainty. And I think, to me, the hardest thing about COVID stems from the idea that there's so much that we don't know, because this truly is a novel virus. It's called the virus that is at the basis of COVID. COVID-19 is the disease. You're infected with the novel coronavirus, and it's called novel because it is brand new. It's one that we haven't seen yet. This time last year, we weren't aware of this particular virus. And I think that uncertainty means that we are, all of us as communicators, as healthcare workers, as researchers, we're working with a moving vehicle, so to speak. We have to communicate. We have to serve our communities. And at the same time, the information we have about COVID changes because we increasingly know about, we find out more things about this actually really weird virus. It has some very, very interesting and in some ways weird components that we just didn't realize it had back in March or April. I think that sense of uncertainty is difficult for everybody. I think it's gone in waves over our community. It's, there's times where our communities open up a bit more. We seem to be in a bit more of a peak again, or peaking, having a second wave. And I think that sense of uncertainty, I think, is what fuels almost everything else that we see happening with COVID. And I wish we had more clearer answers. We have a lot of answers, but at the same time, there's also a lot of things we don't know. We don't know when a vaccine is going to come out. We're pretty confident we're going to have one, but we don't know exactly when. We don't know what it's going to look like. We thought for a while that children were not as susceptible, that they, in a lot of ways, perhaps even couldn't get COVID. That turns out not to be true. So all that uncertainty, I think, makes this for an interesting and for a very vulnerable time for everybody, because it happens in the light of everything else in our lives. It happens in all the other things that happen, our communities, our families, our education system, our healthcare. In the midst of COVID, people still get the flu, they still have cancer, they still have appendicitis, they still have are affected by depression and other mental health issues. And so COVID sort of adds an extra layer to that. And I think that, to me, has been the biggest overarching thing that you can really bring a lot of things back to.
I will say, from the Health Hub perspective, and Tamera could definitely jump in at any point here, is just exasperated a lot of the disparities that had already existed in the community. And if you already have a disparity in access and transportation and housing, and access to equitable opportunities for economic development, if you already have access issues to a lot of those things, overlaying a pandemic that has suppressed a lot of those opportunities, just exasperates what we already knew to be true. Just like the technology divide that exists in our communities before, not everybody had access to Wi-Fi, to devices that could do some of the work they need to do. Just if you're going to do telemedicine in a pandemic, you would need to have access to some of these things. Making sure that our kids have access to this, to be educated if you're unable to be in a school system. So it exasperated a lot of the disparities that exist in our communities, and it has allowed us in some ways to grow closer to what those disparities look like for our individual community neighbors. But at the same time, as we zoom out, how can we be a lot more collaborative in our efforts across many organizations, agencies, resources, and stakeholders that exist in our communities, in order to make sure that we are moving forward in a quicker stance about addressing some of these things that we can. Some of these things are institutional and systemic in nature, but those particular disparities that we have been working with in a lot of our marginalized communities have just been tremendously exacerbated during this time, and making sure that we're able to constantly communicate with our neighbors, our stakeholders, and our agencies in a way that sees forward momentum, and not just temporary band-aids, is also something that I think requires a lot more intentionality and effort. And I think as communities, the wonderful thing I will say, as a result of COVID, we've been able to do that a lot quicker, because we understand the urgency and we understand the needs that exist in our communities, are something that we can't wait for some of the traditional pathways to happen. So I bounce it over to Tamera to see if because she works one-on-one with our community members, so much more than I do. I wish I had an opportunity to do it more often, but she does it in a wonderful way.
So yes, I would definitely say, because of COVID, I've seen an increase in eviction rates, depression, the need for navigation to mental health services. What else? Let's see. A lot of community members feeling behind because they can't grasp the concept of this new virtual world. It also set me behind because I've worked so hard to get community members connected to primary care and going to their doctor visits. And now I have to work extremely hard because they're like, I'm not logging into Zoom to see a doctor to talk to me over the phone. So now what I did prior to COVID, getting them to understand the importance of checking in and going to the doctor regularly. Now they're stopped going to the doctors because of the virtual component, and they not understanding or not even having access to technology to log in to their appointments. So yes, COVID has definitely set the community back, along with my work in the community as well.
Yes, I can add, in addition, what was mentioned before, that the Hispanic community have been impacted in many ways. As Natalie mentioned, all those social issues have been impacted. The Hispanic community, the work is more that essential work that we have. That probably show us the big number or increase, especially in the central Virginia area, in addition to other parts of the state. But the city of Richmond and Chesterfield was a very high, and still we are dealing with some specific area impacted by COVID infection. But people lose their work and they don't have health insurance. They don't have the possibility to any income while they lost the work. So that was a big impact that we saw in the beginning of this crisis. Uh, Without food, people were not able to pay the rent, their bills. So it was a very hard time. Now we are more, we see more move in terms of work, in terms of, but still are people who are working less time. But in the beginning, people were not able, and we had partnership with different organizations to uh, delivery food, because many people were not able to have food because they don't have work. Other issue that they have in the housing part, that small house for a big family, uh, is very difficult to isolate people in that small place. Uh, Family with small children, with a family member infected, how they can go out, a single mother, go out to be isolated in a hotel or any place different their house, who can take care of the children. Situation like those uh, issues that we have to face, and some of the community health workers were very close to those families, helping see how they can help. But we had that connection with other organizations, and that's where we see that the value, as I mentioned, always the community worker have in the community. They can see very close those problems that people are suffering. So that's what we see with for the health services. We know that the Hispanic community, most of a great percentage of the Hispanic community do not have health insurance. The access is very difficult. We establish a phone line, as I mentioned before, the WhatsApp group, to facilitate people access, but we know how difficult has been also for the health system to assist all the people at the same time, even for primary care services. And still we are dealing and trying to be connected with different clinic and facilitate health services. And we cannot probably see those people that need to be controlled with for cardiovascular problem, diabetes, all those chronic disease that need to be assisted. People were afraid to go, as we know, to go to any clinic. So that type of issue impacted very, very much. And we will see how we can keep working together with other organizations close to the health system in a coordinated manner, we can overcome all those situations, but the impact have been very, very uh, big impact in many different ways.
Great, thanks for each of you sharing of how COVID is impacting your communities. I know it's been a real challenge dealing with, like Janine said, the uncertainty and then the unemployment associated with COVID, and lack of health insurance, and access to internet and technology, like Natalie and Tamera said. And I feel like we're in a really good place, at the Health and Wellness Library and La Casa and the Health Hub, to be able to provide information in our communities and resources out in our communities to help with some of these things that are issues. At the Health and Wellness Library, we've been conducting, regular programming on how to identify COVID misinformation, how to find reliable health information, how to find resources to deal with COVID. Also, we've even done some programming on just coping through COVID. We had a guided stress relief meditation session. So, so many people are really, stressed out right now, dealing with all the things that have been going on even prior to COVID, and then everything, with COVID on top of that has just created a lot of stress. And so we've, been doing those programs. We've created a library guide with links to resources about information on COVID and links to mental health resources. So that's just a little bit of what we've done at the Health and Wellness Library. So I wanted to ask our panelists to talk to us a little bit about how you've been sharing reliable COVID-19 information and resources to help them cope in the communities.
I can start, Dina, with this. Yes, it was a big change for La Casa. We used to uh, participate and implement events in the community. That's what we used to do in the past. When this crisis started, we have still that group connected through WhatsApp. WhatsApp is a communication that we facilitate material. We have been focused on CDC, Health Department, the Virginia Health Department, and some specific uh, material from the Central Virginia area, the Richmond Health District and Chesterfield Health District and Henrico, through WhatsApp. We keep communicating those 30 community health workers that we have connected in the WhatsApp. In addition, they have, and we have other leaders, churches, leader from churches that they have connection through WhatsApp, also with other people. That's the main communication that we have. But we have been posting on Facebook. Many Hispanic use Facebook here and are connected and taking that information from the CDC and the health department. We use also the phone line that we have at La Casa de la Salud when people need a test or health services or any general information. Sometimes the food, we participate in as I mentioned before, in a partnership to delivering food to the people. They call to that phone line to be registered, take the food, or we deliver sometimes the food to those um, people that need the food. In addition to the WhatsApp and the Facebook, we use uh, the Zoom for basically for continue education, as I mentioned before, to reinforce education, to guide the community health worker about any specific issue, as Janine mentioned before, the mental health issue that we have today. violence, in domestic violence that we have that conversation among us through Zoom. But we have a calendar, Facebook Live, and we choose conversation in that Facebook Live because all what is changing. Every week we have different issue. As was mentioned before, the school is probably one of that have brought a different situation that we need to uh, talk about that piece. We have also Medicaid expansion conversation recently through Facebook Live. The community participate and the community health worker participate, and they are connected to people who need that. So even when we used to be in the community, we are still connected with the community. That's what we are dealing with this situation and communicate health information especially for the COVID.
I could say pre-COVID, I used to do mainly door-to-door outreach is how I provided information to the community. But now I rely heavily on our social media pages through VCU and through Richmond City Health District. But that could be a vary as well, because like I mentioned earlier, a lot of people don't have access to technology. So now I have to be strategic of where I decide to put flyers at. So mainly at the library, at the corner stores, places that I know have a high volume of traffic. So I have to be very strategic of where I do flyer placement. Also, I would say that word of mouth, like calling our community partners, let them know that yes, we are open. Our hours have changed, but we're still providing the services, and just letting them know that we're still here. And once one community member find out that we're here, that's basically our go-to. They're going to let the rest of the community know that yes, the Health Hub is open. They're still offering services. So yes, word of mouth is how we basically share information now, our social media pages, and being strategic of flyer placement, and just connecting with other partners and letting them know that we're definitely still here providing services.
Let me jump in for a second. My focus is not as much as communicating directly with the community, but one of the things I think that is really important, and I think that is something that I've heard everyone else on this panel say, is using the appropriate sources. There's so much information out there. We're in an overflow of information, especially if you look online, but not just online, because the information that exists online, excuse me, or that exists on WhatsApp, or it exists on Facebook or anywhere, it interacts with everything that we say to each other in person. And because it's such an environment of uncertainty, I think it's really important to take the sources that we know that are reliable. Here in Virginia, the Virginia Department of Health, the entities that work with the Virginia Department of Health, the CDC on a national level, the World Health Organization. And I think one of the going back to those organizations and those entities doesn't mean that there's never going to be information that wasn't correct or that it has to be adjusted. For example, we were pretty sure that from a public health perspective that you didn't have to wear masks in, say, the beginning of March of this year. As we found out more information, as there were more studies, as we saw COVID develop and develop into a very different type of disease, we realized public health-wise that wearing masks is actually one of the better things you can do, especially before there's something like a vaccine or more reliable and safe and high efficacy treatments for COVID. But the fact that information gets adjusted doesn't mean that the information is not reliable. And I think having information come from entities that are willing to say that are willing to say, okay, we're adjusting some things here. Here's the best of the knowledge that we have right now. In a perfect world, communication wise, I would have liked to have had 3 or 4 months to study COVID and then start communicating. But that's not what happened. We were thrown into this as we knew a little bit about it and we found out more information about it. So I think using information from these sources is really important. Listening to people like Dr. Fauci from the National Institutes of Health. Again, we need to have constant voices. And I think that is one of the things that we've been seeing, that information, the other advantage of that information is that all those entities, Virginia Department of Health, CDC, World Health Organization, Dr. Fauci, you name any of these public health entities, they're also very willing to listen and to communicate, have us communicate back to them. And I think that is it. Communication is at its most effective when it's a two-way street. When it's not just here, let me give you information, but what are your concerns? What do you see? What are you worrying about? So I think that just kind of ties into both what Antonio and Natalie were saying right now is that idea of sources. And also I think the other thing is we need to give people the information that they're asking for and that they need, not overwhelming them with every bit of information that's out there. And I'm preaching to the research choir here because we tend to do that. Let's make a really big infographic and have everything about COVID on there. Yeah, that doesn't really work. People have specific questions. And so I think the idea, the concept of being in the community, of having community-based clinics, community-based health workers, like the Health Hub, like La Casa, it's always been crucial. I think we're seeing more how crucial it is in the midst of this pandemic. And so I am profoundly grateful for all of you and for the connections, because it's going to be really hard to communicate in the midst, again, of this uncertainty if there's not a level of trust. And I think that you all are able to do this communication because there is a level of trust. You have been building on this. And I think that is something we need to learn about. This is not the last pandemic that we're going to live through. This is not the last health emergency. This is not the last issue that we're dealing with. So.
Great. Yes, thank you all. Did anyone have anything to add before I move on to the next question? Okay. Yeah. So yeah, thank you. That was great. I really, appreciate everything that all of you are doing in the community to provide reliable resources. And one of the things that we're going to, shift gears in the next set of questions is that, it seems like, we want to provide people with reliable information. Like Janine was saying, can't give them everything. We don't want to give them everything. Sometimes I feel like as a librarian, I want to, give everybody all the information I can find on a particular topic. And so this leads us into our next question, is that we are inundated with information about COVID-19. We hear it on the radio, the internet, social media, family and friends. I have, I see it all the time on Facebook. I even have, friends calling me up, telling me things, that they've heard about COVID. So all of this is leading to information fatigue. So I wanted to ask you to give your input on what are some of the problems that result from having too many sources of information about COVID, and how can we deal with information fatigue?
I'll jump in here. I think a lot of the problems that result of having just too many sources of information, you water down the information in a way that people are not able to grasp onto the things that are most important. They sometimes get caught in the crossfires of, well, what about this and what about this? And when in essence, you really want them to take away like 3 or 4 major points, and then everything else is just, a consequence of those major things. And so one of the the issues that often arise, I know in the work that we do across the board, is making sure we're clear and concise in the information that we provide so that people are able to grasp onto that information and hold tight to it enough to actually follow through on the information provided. I think, it's always good to have a healthy skepticism of the information you receive. That's the reason why we often are working in partnership with our neighbors and our community partners to make sure that they're able to decipher those things that shouldn't be in contention as far as like how you take in information. Like you should be able to dismiss something that is like offshoot crazy off to the side. And we can have a whole nother panel discussion about what we quantify as crazy information. But it's one of those things that we are trying our best to make sure that you don't inundate our community neighbors and organizations with so much information that they don't understand what is truth, what is fact, and how they themselves can make the best decision for not only their individual selves, but their families and their communities as a whole. And so we want to make sure we give them information in a manner in which, like Janine alluded to, and I'm sure Tamera is going to follow up and say, what they ask for. People often underestimate the savviness of our community members. They know what they want to know. And when you give them more than what they've asked for, you started that process of them having to cipher through information that they probably didn't intend to know. And it's not just that you're withholding information, it's that they want to know about a specific thing. Give them the factual information, give them the concise factual things that they need to know so they can build from there into some other areas that they really want to know. So a lot of the problems often is the over inundation of information. Secondly, not coming from reliable sources. And thirdly, not trusting our community neighbors to voice what they really want to hear, and then building on that from that space of trustworthiness to say, hey, in addition to this thing, have you also thought about this? And would you like to learn more information about that? And if not, well, I'm going to place it here in this reliable space for either you to come back to or for you to find when you find that this is something that's relevant to what you need. I think once we have a lot more respect for our community neighbors and what they would like to see, what they would like to hear, but also with providing information in a way that is actually realistic in their grasping, then I think we will find ourselves in a different space when it comes to health education dissemination and how we do that collaboratively with our neighbors and with our community organizations.
Definitely, I'll follow up behind Natalie. I would say that too much information leaves our community members confused and unable to make a decision, or either processing it wrong and making the wrong decision. So I would definitely say one way that we can assist them is basically tailoring the information that we share with them, like filtering it and giving them the information that'll be the most beneficial to them. Like not give them everything that we know, because that's what we think that we should do, but basically sharing the information that's going to best suit their life in that moment, like tailoring it to their specific needs, and not just broadcasting and overbearing them with information just because.
Let me add one more thing. I think it's also really important to realize that there is a limited amount of information we can process as human beings. There's just a limit to it. There's only so many things we can address in depth. And so if we don't provide the information that people actually need and that they're asking for, we also run a risk that not only are they not getting what they need, they also may not be processing it a little bit later when it does come their way. And I think that's really important. And I think it's almost, I think it also changes. Again, in this ever-changing environment, if there's one thing that I think we can see about COVID is it changes. I cannot open a medical journal or a newspaper or any kind of social media platform. Every day there are new things. We found out something new. We think something new. And I think sort of being curators of that, being some of the people that vet this information, say what is relevant to my communication, to my population, and how do I then best communicate that, I think is incredibly crucial. A friend of mine who is a social media researcher said one time, the internet is flat as far as knowledge goes. And what he meant by that was there are billions of pieces of information. And by and large, unless we look at sources as human beings, when we look at that information, we're left to ourselves as far as what do we trust? Is this reliable? Is this the truth? Is this what I need to be finding? And that is almost impossible to do for people who are trained to do it. And so I think the role that community health workers, the role that health communicators, the role that medical professionals play in helping people decipher that and navigate this is so crucial, because again, because the overwhelming information level is not going away. Like, that is something that we don't really have a choice in, that exists. What we can do is help people make sense of it and sort of be a guide through that.
I would like to add, Dana, social media, there are no border for social media. So we have through WhatsApp thousands of messages. Probably people are afraid and they send those messages that I feel that could be helpful for anyone. It could be a good intention probably from someone anywhere in any country. And that's what we have been facing in the WhatsApp group, because we get a lot of information from other countries, for Latin American country, for remedies, treatment, all kind of things that we cannot imagine that make people sick emotionally. All that type of information. We have been focused in that conversation that we have with the community health worker or any close friend that ask us if that is good or is not good. It could be good for any place, because as we know, all the resources that we have locally, even in the country, every city and state have their own reality and their own resources to solve that crisis that we are living. Some of them probably work. Some of that suggestion, recommendation, opinion, even from professional that we have seen, cause a lot of confusion. People get confused, and it's very difficult to process, as you mentioned, Janine, to process all that amount of information, and that causes more problem mentally to the people. So we have been focused on, as I mentioned before, we had a training last year with the Health and Wellness Center at the hospital with you, Dana. We have been reinforces that criteria, how to evaluate, what is the source, who said that, and why that have been said, or take the time to read that. So we need to go a little deeper using those criteria to evaluate the information. That's what we have been doing, and reinforcing that with the community health worker before we send forward that information to the rest of the community or any other friend. That's what we have been dealing with this situation today.
Yeah, and Tony, if I can may jump in for one more thing, that's so true. One of the biggest preventative measures that we have, that we know for COVID, is washing your hands for at least 20 seconds. Right? We've heard all the time, sing happy birthday twice and wash your hands. 20 seconds is longer than I thought initially. I apparently never washed my hands long enough. But I think that the concept of that, we also should wait 20 seconds before we share something. Before we share information, and probably a little longer than 20 seconds. But this idea of, we live in an environment of immediacy, and the news functions that way, we function that way. Before we share something, especially something we're passionate about, something that we're like, this, my friends need to know this, take a few minutes. The information is still going to be there. We are not breaking news. as human beings, I'm talking about everybody right now, and take a little time and evaluate that, because once a piece of information goes out, whether it's WhatsApp, it works in person as well. It just goes slower in person. But if it goes online, you can't get that. You can't stop that. Even if you take the message down, it exists in a myriad of ways. So yeah, I really agree with that, Antonia.
Yeah, that's excellent information. I'm glad Antonio and Janine, you brought that up about evaluation. So one of the things when I'm teaching patients or patrons in the library, we have a little infographic that says stop and think before you share this information or before you act on it to make any type of health decisions, and critically evaluate that information and make sure, look at the source, look to see if it's a joke or satire, or if it's just I even see people sharing information that come from headlines that are meant to draw the reader in. But when you actually read the article, it's not what the headline says, but people are acting on that headline. So it's just so important to stop and critically evaluate that information before you share it. Like Janine says, once it's out there, it's out there. And then also we've seen people in the news acting on some information that's false, and it has dire health consequences. So glad you brought that up about critically evaluating health information and using those criteria to anytime you come across new information, to just critically evaluate that. So thank you for that. And and thanks for all the great information on how we can deal with information fatigue. So those were some great tips as well. So Natalie touched a little bit on this next question, but go ahead and ask it, and maybe we can go into a little bit more detail about it. So changes in information and guidance about COVID. So how have you handled communicating COVID information and guidance from health experts, particularly when there have been changes in recommendations? And I know, Janine did mention a little bit about masks, but if you want to go ahead and if anyone else, or if Janine wants to give some more information on that as well.
I'll start. I think one of the most important things is to be honest, and to be quick, and at the same time to be certain. And that's the balance, right? That's the balance that we have. I think we need to do, and by we I mean everyone who is communicating and professionally communicating. There's a real aspect of education here and explaining that a lot of the information that has quote unquote changed comes down to the fact that this is a new virus, that this truly is not, it's not just another cold, it's not the flu. It has some similarities in the way that it expresses itself, but it's not the same thing. And the idea of, I think, really making sure and telling people, look, we're giving you the best information that we have. Some of it may change based on what we know and based on how we understand things and based on what we're able to study. We want to give you information when we have it available, but we need you to realize that these things can change. And I think that idea of that we're in a moving vehicle. We're not starting, and having 3 months to prepare for this. I think the other thing is the level of trust, and that is something that you cannot build instantly. And so I think the best organizations that have been communicating well are entities, communicators, organizations that already had developed a solid level of trust between them and the people they're communicating with, of approachability, of, but I don't understand. You said we didn't have to wear masks and now we have to wear masks. And then I see lots of information about that wearing masks actually makes that I can't breathe and maybe I'll get even sicker, and those kind of things. Being able to bring that back to, okay, let me explain to you how that works. Actually, a reason for this. I think that there needs to be a trust relationship there. And I think that is one of the things that we're missing a lot of times in the digital realm, because we can see everything and everybody. And the other thing that I think is makes it harder is the first thing that we hear as human beings about an issue or a topic or a potential treatment is most likely to be the thing that sticks, whether that information is correct or not. And so if somebody became convinced, for example, that hydroxychloroquine, a medication that is used for treating malaria, there was some initial hope that it might actually work to treat COVID patients. And once someone becomes convinced of that, it is really hard to change their mind on, you know what, we were able to do a clinical trial, several clinical trials, and actually it may put people at higher risk. That type of switching information is really hard. So I think the best we can do is keep developing that trust, keep being honest with people, answer the questions that they're asking. I think that Tamera and Natalie, and we've all been talking about that, is really, really important with that. It is a hard thing. This is a hard thing. And I think also the concept of saying, look, this is a moving vehicle. Things are developing. We're getting to know more about this virus. But we're not going to wait to communicate until we're 100% sure about everything. We can't. We need to be able to get information that could save someone's life out there.
And I would add to Janine's wonderful answer is to also make sure we're uplifting those voices in spaces that aren't traditionally held in certain spaces. So for us is when you have experts that know about this information, that are doing the work, that know the intricacies of the changing and shifting dynamics of the information, to make sure you're providing a platform, if you have one, for them to make sure that they're giving that information as well. It's making sure you're leveraging the trust that you've built with the community members in which you serve and the agencies in which you partner with on behalf of someone else, because they are the experts in this field and they just need another opportunity, another place, a place to share that information so that it actually sticks the first time, and we're not having to deal with third-hand information by the time they come to a health hub or La Casa. It's making sure that we're sharing our space for those subject matter experts. I will also say making sure we're uplifting voices to communities that reflect those communities as much as possible, because oftentimes building trust also means that you can relate to someone in a way that others may not. So making sure we're sharing our platform, but we're also creating connections to experts and expertise that reflects the community or the lived experience that our community members also go through. So I know through the Health Hub, we try to do that through experts amongst the vast network. Dana, you know this, of what we have internal to the health system and to the university. We have a number of different experts, but we also are able to take those experts, place them in spaces that people can truly connect with. And then also working with longstanding organizations and agencies in the community that have built trust, that have built relationship with our neighbors, with our other community organizations, like the health department, like nonprofit organizations, like some of our coalitions and our tenant councils, to make sure that we're garnering and leveraging spaces that are comfortable for people, but also placing expertise and information in those spaces so that it can actually be grasped and held on to in a relatable way. So I would say dealing with and communicating information, particularly when there's been a lot of changes, is, to Janine's point, create safe space, stable space, familiar space, and then take that expertise and try your best to insert it in a way that's going to make it really relatable to the people that are receiving it.
And so next, I wanted to talk a little bit about misinformation and disinformation. We talked a little bit about evaluation. So that's, how we would evaluate to find out if it's mis or disinformation. But we didn't really talk a whole lot about how what misinformation is. So if you could talk to us a little bit about misinformation and the disinformation, tell us what it is. And have you observed misinformation and disinformation being circulated in the communities you serve? And what are some ways we can combat misinformation or disinformation?
So we tend to use the term misinformation for almost all of this. But technically, misinformation is incorrect information that is spread inadvertently. Disinformation is misinformation, wrong information, incorrect information that is spread intentionally. And so a lot of times incorrect information starts out one way and then spreads into the other way. We've seen this with specific videos being out there this summer where there was absolute incorrect information and it was spread intentionally, and then people spread that information, and for them it was misinformation. People weren't intentionally spreading something that was wrong. They thought the information was actually correct. I think the biggest thing is that there's gradations of misinformation, disinformation. There's information that is flat out wrong. Please don't gargle with bleach to prevent COVID. That is something that actually, if you do it, will actually cause harm to you. There's a good chance that it will cause harm, apart from the fact that it doesn't help. There's other information that in and of itself is not all that harmful. So there were people who were saying online that eating garlic would protect you from contracting and COVID and actually would help COVID get better if you got it. That's not true. But eating garlic is not necessarily a bad thing. If your digestive system can handle it and the people around you can handle it, eating garlic is not a bad thing. Have at it. The problem with something that seems to be more innocent is that it may give us a false sense of safety. Well, I mean, I'm eating a diet rich in garlic and I drink a sip of water every 10 minutes. And I think I still have some antibiotics laying around, so I'm going to take those. And I live in a warm climate and COVID can't really spread there. What that does is it gives people a false sense of safety, and that may mean that they're not as diligent about washing their hands for 20 seconds with soap and water, social distancing, wearing a mask. And so I think there's different levels, but they all can have an effect that in the end, the effect that we are trying to prevent is people not adhering to the things. Here's the thing that we need to do. Until there's a vaccine and until we have proven effective, safe treatments that are accessible for everybody, the best thing we can do is preventative measures. And to be honest, they get kind of old after 6 to 9 months. Social distancing, staying physically away from people, not going to big gatherings, not seeing your grandparents, washing your hands or using hand sanitizer for, what seems like a million times, wearing a mask whenever you go outside of the house and you think you might have an issue with social distancing. Those things are getting laborious for us, I think, especially as we're into this more, but they are what we have. They are how we can protect ourselves and those around us. And I think that's another thing, a component of one of the things that we can do with COVID is we can not just protect ourselves, we can protect those around us. And I think the call to that, let's protect our communities, is hugely important. The sense of community that I am not just doing this so I stay healthy, I'm doing this so my grandparents stay healthy, my parents, my friends, my church family, this idea of we are carrying this together until there is a vaccine, because there is light at the end of that tunnel. And I think those preventative measures are so hugely important. And where misinformation and disinformation, really in the end, it doesn't matter how it's spread. I just get way more upset with the people who spread disinformation, who do this intentionally. I really don't like them. But the fact that the information is out there, what it does is it makes us feel safe in a manner that we shouldn't, and it makes us not take the measures that we should take. And I think that's why it's so important to try to make sure people have the correct information earlier, and to make sure that people know there's really not that much information that people need to know, that we need to communicate with people. You can really bring it down to you know, a number of small but very direct messages, but they make a huge difference, and we see it around us every day.
I would definitely say that Janine hit everything on the nose that I had wanted to say. Yeah, basically, I don't even want to go ahead and like repeat everything that she said, but like literally everything she hit on the nose.
I was reading your mind. I was just right there. I was in touch with it. Keys, could you share slide 1 with us real quick? I wanted to show one thing that really shows the importance of catching misinformation. This is slides 1 through 3. This is just a, and I'm not sure if it's.
Yeah, we might not be able to see it on here, but the viewers on YouTube Live.
Okay, all right. So I can assume it's up there. Okay.
Yeah.
So, here I have 3 little slides that sort of explain how misinformation, why it's such a problem, especially online. But again, we can't separate it from online and offline, right? We don't live life separated. We live life as our whole, as a holistic entity as human beings. About 2 years ago, there was a press release that came out from an Israeli hospital, and researchers that said, we have found a way to cure cancer. Within a year, we will have a cure for cancer. And the message seemed to be very reliable. And cancer is obviously it's a huge health issue. I lost my dad to colon cancer a few years ago. I would give almost anything to see a cure to cancer. So this is something that really reaches people's hearts and people's minds. So these researchers brought this news that we're on our way. In a year, we'll have a cure. Next slide. That information started spreading online like wildfire. If you're seeing what I think you're seeing right now, you see how this information spread on social media, and it went from news organizations to individuals to other organizations, and it spread incredibly fast because it really looked like it was something that A, gave us hope, and B, that actually might be true. Well, have you ever heard that if it sounds too good to be true, it usually is? That's slide number 3. No, the researchers weren't able to devise a cure for cancer within a year. And actually, a day after this message went out, people realized, wait a second, they're drawing conclusions that you really can't draw. Turns out they were too hopeful. I'm not ascribing motives, but to be short, we're now 2 years later. There is no cure for cancer yet. Here's the problem. That initial message, there's going to be a cure for cancer, from one outlet and one message they sent out, Forbes, was shared almost 800,000 times. As soon as Forbes found out that, oh, wait a second, this is not really true, they sent out a retraction. They did the right thing. Hey, by the way, this is not really true. I mean, there is some hope, but this is not what actually that message said. That message was shared 6,000 times. So you see the problem. The initial message was shared millions and millions of times. The correction was shared several thousand times over several organizations. And that's a problem. Then you take that to something like WhatsApp. You take that to something like Facebook, like Twitter. And then you take that to word of mouth. You take to, hey, guess what I just heard? It is almost impossible to get that back. And so, yes, we need to find ways to address misinformation. My deep wish is that we get better at preventing misinformation from getting out there earlier on, because that is, again, like I said earlier, we can't take this information back, and it starts living its own life, both in person as well as online. So all that said, take the 20 seconds or take the 20 minutes and figure out if the information is something you should be sharing.
Great. Thanks so much, Janine. That was a great overview of what misinformation and disinformation are, and ways that we can combat it. And again, using, like we've talked about throughout this discussion, using those evaluation criteria, anytime you're hearing information, it's just, and to help stop that spread, help prevent the spread of misinformation. And always, thinking critically about any type of information that you hear. So there's so much to navigate, and we've talked about how we can share reliable information, how we deal with information fatigue and changes in official health guidance. We've talked about ways to evaluate information and combat the spread of misinformation. But now I want to shift gears just a little bit because there's so much involved in communicating COVID. I'd like for us to talk a little bit about how we can communicate effectively with individuals about important COVID issues. So my first question along those lines is, what are some approaches that we can use to correct someone who spreads information about COVID without shaming them or without being viewed as a know-it-all or, upsetting someone? So, what can we do to combat or to correct someone, an individual who's posting information that's incorrect?
Yes, Dana. I personally have had different situations and cases. We know through WhatsApp, we receive a lot of information from friends, family members, community health workers. Several times I got information that I just taught to them, please not share this. But I give them an explanation why not. I need to tell them why that information, we cannot share that information if there is not scientific support for that information. That is the many times we receive that information, as Jenny mentioned before, uh, we didn't take time. That people, what I say, they don't take the time to confirm and check and evaluate, see that information can be shared and help other people. So I have that conversation. Um, Now, when I speak with them, I can see that they have a different reaction. Sometimes for that experience, those friends and family member and community health worker, they ask me, what do you think about this? Do you think it's true? What do you? So I think that's probably one of the way that we can contribute and help other people, just checking, helping in a very good manner way to help and contribute, not to spread uh, uh, more information that is not a good information, helpful information. It's very common to probably see uh, home remedy that we use in Latin American countries. They probably don't have any problem with the health of some people, but some type of herb can have a reaction if those people are taking medication. As we know, people are taking medication, they cannot take herb because it's natural. People say that it's natural, and people think that any natural thing cannot react with medication. And we have to check that. That is a very common mistake that people made uh, with a good intention to help other people. So I think, and again, is to take the time, check, and ask anyone that I know that can help me to evaluate if that information is a good information to be shared with other people.
Yeah, that was a great point, Antonia, about people's intention. I think a lot of times people do have good intentions, and even when they're, maybe spreading misinformation. I know a friend of mine back early on during COVID called me up and told me that, if I held my breath for 10 seconds and didn't, have any, problems, then that meant that I was COVID free. And, it's like one of those things that Janine said that, some of those things you can do and, it might not harm you. So I did it just kind of out of fun. It's not something that, holding my breath for 10 seconds isn't going to harm me, but that false sense of security, oh, I don't, if I were able to do it. And, that could be where the harm is. But what I did was, I talked to her and then I looked it up on the World Health Organization, Mythbusters, fact sheet and read her that, no, the only way, you can know that you have COVID is through a test. So I went to that really good, reliable source. And this is a great friend of mine. So I didn't want to hurt her feelings or shame her in any way. So, I told her, oh, feel free to, go on that site anytime you hear something and double check or just look through the different, the list of the different myths and read down through those. So that's a great place to go to, if you do hear some information that you're not sure if it's reliable or not. So, and it's just a great place to refer people to as well. So.
And Dana, two more quick things in response to what you were just saying, because I so agree with that. I think number one, I think it's a really good idea to recommend that people have a place to go to check things. And for some people that may not be the World Health Organization, although I adore them, I think Mythbusters that's my place to go. But if you know that someone, say, doesn't trust WHO or doesn't trust the CDC, there are lots of other places, but that people have a place to check information where you go, hey, this is usually a reliable source. I think the other thing that's really important is acknowledge that people are scared, is acknowledge that people who may spread misinformation are not doing that to harm people. They actually want to help. And that in the midst of all this, being concerned, trying to find things that will help and that will make this go away or protect us from it is incredibly human. And acknowledging the humanity in all of this, I think, is really important. If people spread disinformation or doing it intentionally, that's a whole different ballgame. But if people are looking for solutions, they're looking for ways to make some sense out of this, they're looking for a way to feel like they're protected. Here's the good news: we have ways to protect people. It's called washing your hands for 20 seconds with soap and water, social distancing, wearing mask, etc., etc. Those things actually do work. So I think maybe that is one of the other ways to communicate with people, saying, I completely understand. I am looking for ways to make it through this as well. But connect them with the things that we know work. Really, washing your hands is not that much harder than holding your breath for 10 seconds. In some cases, it might be easier. And I think that connection with saying, yes, there's actually, I completely can relate, but here's ways that we can actually keep each other safe, and not just keep yourself safe. You can keep your family safe. And no, it's not easy. Acknowledge the reality that this is not easy. This is a hard environment. Washing your hands is not that hard, but social distancing for 6, 7, 8, 9 months, it gets old. So understanding and validating that, I think, is really important, and understanding that, as hard as it is for us at times, that's really understandable. It's hard for people, and especially if they deal with additional, like Natalie was saying early on, with additional health disparities that are being exacerbated by this. If they're already dealing with additional health issues, if they have lost their job, all the things that make life harder in addition to things, COVID just adds on to that. And so that reality, I think, is really important to acknowledge and say, you know what? Yeah, this sucks. This is a hard environment, but we can get through this. There is light at the end of the tunnel. We just don't exactly know how far away that light is yet.
Yeah, thanks, Jeanine. Yeah, that's definitely really important. So I want to, so we want to, you hit upon with the World Health Organization, and you, I think, used the word trust. So that kind of leads me into our next question. What are your recommendations for taking or talking with someone who does not trust science or a research or medical institution? So what's some advice that you could give us to talking to those people who may not trust medical institutions or the science?
Dana, I would say, well, first and foremost, this particular work we all have to recognize, and which Janine touched on earlier, at its basic fundamental communication. When dealing with other humans, it's a relational thing, right? We're all in trying to build relationship, either with the source of information, with the other person that's providing information, with the process of that information. It all becomes relational in nature. So when having an exchange with someone who doesn't necessarily trust the science or trust research or medical institutions, for me, it starts in that relationship phase where you're trying to understand the root cause of the distrust. Why do you not trust the information before you? I think if you start there, it's easier for you to find a way to guide them, or at the very least provide resources and tools to connect to why it should be trusted. But starting foundationally at why you distrust, and people distrust for multiple reasons. They can distrust because of a lived experience. I went to the doctor didn't see me, so therefore this narrative that you're providing me doesn't necessarily align with what I've experienced. They can distrust for religious reasons. They can distrust for cultural reasons. They can distrust for regional reasons. There's a lot of different ways and processes for people to mistrust information. And I think we all should acknowledge, as the human parts of us, it is okay if that happens. It's about making sure, though, that you can then go from that distrust to connecting to something that you do trust, so that you can make sure that you're able to vet that information. And so oftentimes for us, I know what we try to do is first and foremost build relationship with people and understand the root cause of that distrust. And then secondly, make sure they understand that we ourselves have a healthy skepticism of the information we receive. And because we have that healthy skepticism, we go through a process of evaluating and looking at the information that's provided, who it comes from, what source it comes from, how it connects to the world in which we live, which connects back to what Tamera was saying, how it's relevant for our lived day-to-day lives and how it could be relevant for them, and what other things need to be in place, kind of dissecting what other things need to be in place in order for them to get to that place where they do trust the information. Because just putting information out there and saying that this person says it's okay is not always enough for people. And that's okay. For us, it's all right for you to say that that's not enough for you. If we need to go through those additional steps because we've been trained to do so, to make sure you get to that place where you can at the very least say, hey, I don't trust all of the information, but these elements I do trust because they're in the benefit of me, my family, and my community. And I will make sure that I can use them because they will affect us and they will impact us. I think is a starting place. And then from there, once they've gotten to that place, go into some of the greater things that go into, well, why overall do you now have skepticism regarding this particular thing? And how can we collectively and collaboratively walk through what needs to take place in order for you to build trust? And that takes also time. That goes back to those things about stopping and waiting. Since we're in that space where people they need to instantly trust it because such and such said so. I said, well, distrust builds over time, just like trust builds over time. And you have to make sure that you're patient enough to understand the person and where they come from, and then make sure that you are guiding them to a space that they can build on later on, absent of yourself. Because after we do the work of connecting them and guiding them and trying to make sure we create a safe space for them to now trust that information, we have to trust that they continue to do that and they use the resources and tools that we've provided to them so they can do that beyond this one particular instance to other instances that may attach themselves to other things beyond COVID. So I think those are some of the tools, and just making sure from a humane standpoint, we start first with the root cause of the distrust and create space and opportunity to understand that, be empathetic about that, and sympathetic about what that may look like, and then move from there.
I can add also, Dina and Natalie, probably we need to explain people sometimes that the scientific information and evidence is a thoughtful process that take time to produce with a specific method to produce information or a result. It can be for a treatment, it can be for vaccine. It takes time, but that process creates a consensus. It's not just one study, are hundreds of studies that create a consensus of experts, and then we implement that treatment or vaccine. Is different than when the that what is happening today. In this crisis, we have a lot of professional opinions in different ways, as I mentioned before, from different countries, and that create people probably uncertain to decide if that's good, is not good. Probably that have been difficult at this time to deal with that situation. So we need to explain in a very simple manner that evidence uh, create the result of that evidence is implemented after there is a consent or hundred of a student that a study that show the same result. I think that is a key part that we need to talk today with all these situation that we have with the crisis. We have a lot of professionals talking about a specific issue about the virus, about the treatment, uh, protection, uh, all kind of information that make people confused.
Yeah, and I completely agree. And I think too, like, two more things. We have to understand what is it that they mistrust. So, for example, the future COVID vaccine. I hear a lot of people right now, including people who normally are not hesitant about vaccines, say, this is going way too fast. I can't trust a vaccine that was developed in less than a year. Normally it takes, 4 to 10 years, and that is fast in vaccine development land, which is true. But explaining, if I know that that is the root of their concern, then I can explain, well, let me explain to you how vaccine development works. And yes, certain things have been sped up, but those are not the safety things. The things that have been sped up are that some of the development of the production of the vaccine is being done with the understanding that if the vaccine doesn't make it through the safety checks, all that production is going to be thrown out. So worldwide, we are willing to invest in this to an extent that we've never been able to want to do that and been able to do that, and really see where's the rub. What's makes someone say, I don't trust this, because there's always a reason for it. And understanding what that specific reason is and being able to communicate and say, well, here's some additional information. This is why I trust that. I think if there is a level of personal trust, that is another really powerful thing. I've heard Dr. Fauci say, for example, I will take this vaccine if it's approved by the FDA. Well, I don't really know the FDA very well, but I trust Dr. Fauci. So I will get the vaccine if Dr. Fauci gets it. Well, that dynamic works in community health. It works with lots of areas. I think the other thing is we need to know what sources people trust. If they don't trust the CDC or they don't trust the medical establishment, find a source that they do trust. What about a religious source, a source of religious community? What about a family source? What about look, we have all heard the word influencers, right? And we look at that a lot of times from Instagram and makeup tutorials and things like that. But all influencers are really at its heart is people who have a level of influence because people trust them. And so we can find who are the influencers that the person I'm talking to will listen to. If they really don't trust the CDC, it's useless for me to point them there. That's only going to make it worse. But there are other places that use the information the CDC uses that I can get them in touch with and say, you should listen to Bishop so-and-so. You should listen to celebrity ABC. And so I think we need to get better in as far as health communicators are concerned about using that. Sometimes the most reliable public health organizations are not, they're not always the best source because of everything else that's developed, and that's okay. They still are the source for the information, but maybe as the communicator, we can find other entities that will take that role. If we find someone who is really skeptical about that particular source.
Great. Thanks. That was some really useful advice. And Janine hit upon our next question. So a great lead in for this, as well as talking about vaccines. What are some suggestions you have about how to talk with someone who has questions and concerns about getting a COVID vaccination when it comes available? When they're, especially knowing that there are already people who may have questioned vaccinations or are against vaccinations. So how do you handle communicating with someone who is hesitant about the COVID vaccination?
I think the first thing is you need to figure out, are they just hesitant about the COVID vaccine? And do they in general trust vaccines? So in other words, they vaccinate their children with the measles vaccine, a chickenpox vaccine. They tend to get the flu vaccine, but it's the COVID vaccine they're hesitant about. Or are they hesitant about vaccines in general? So it's not just a COVID vaccine. They don't really trust vaccines, and therefore they also don't trust the COVID vaccine. I think knowing that is really important. I think it's easier to communicate with someone who just doesn't trust the COVID vaccine, but in general vaccinates, because this is, again, it's a new virus, therefore it's a new vaccine. And yeah, the fastest development of a vaccine before this was 4 years. So no wonder. I mean, I've had thoughts of going, well, that goes incredibly fast. Now I know that there's reasons for it. So I think knowing that, like, where are they coming from? And again, I think that comes back to the first thing we talked about. We need to know what the question is. The question may not be, I don't trust vaccines in general. I just have an issue with this particular vaccine. Or the question may be, I really am concerned about vaccines in general. That's a harder one. But the thing that we have that may help us, a lot of times vaccines, we don't see the disease that vaccines are supposed to prevent. We don't see the devastating consequences of, say, polio. We even don't see the potentially devastating consequences of measles in our environment anymore. With COVID, we see the pictures with the ventilators. We see the doctors and nurses and medical personnel talking on screen about how about what this disease means. And so part of my hope is that one thing that is in our advantage, that people will understand more that this is a potentially very serious disease. Now, that plays into everything else. If I don't believe that COVID is serious, if I believe it's just a mild case of the flu, which is another part of misinformation or disinformation, that makes everything harder, right? This is not a simple thing. It all ties into each other, and it depends on, you pull one strand of a fabric and things can unravel pretty quickly. But I think those are places to kind of start and to really understand what's the question people are asking and trying to address that. If it's that they're just concerned about the COVID-19 vaccines, there's ways to address that. There's also ways to address that they're concerned about vaccines in general. Both of those are addressable, but they shouldn't take each other's place.
And to build off of that, I also would say that you don't know until you go through it, right? So giving yourself grace and space to learn about better ways in which to communicate about the vaccine as it's being developed, because in and of itself is a nuanced thing, right? And so to Janine's point is dealing with the fact that if people have skepticism and some reservation about vaccination in general, how do you go through that process? Add on top of that, the COVID vaccine, but also learning as we grow and know more about what's happening to have better conversations with people. I know here at the Health Hub, we often practice, we take people as they come, as they are, but also we learn from how we communicate with people so that we can take the best of those communications to the next person. And so in this particular case, because this is an ever evolving, ever changing situation when it comes to COVID and information in general, anybody that has hesitations about vaccination in general, we can do some things because we have a little bit of leg room with that. But when it comes to the COVID vaccination in general, we have to give ourselves as practitioners and as communicators a little bit of grace and understanding that those conversations will get better over time as more information arises and more opportunities we have to talk with people, and then being willing to talk to people who have a healthy sense of skepticism. I think that's another thing. When communicating, we have to be at that space where we're okay with saying, hey, I'm willing to have a conversation with somebody who doesn't want to be vaccinated whatsoever. And if only just to learn why you have that hesitation, what we need to do in order to better inform so that we can do so for those people who may be on the fence or maybe a little bit more open to. So I think making sure you communicate, no matter who brings you the piece of information, is one of the ways in which to better communicate about any vaccination, just to also include the COVID one.
Yeah, and I think the other thing too is be honest with people. It's really tempting to say vaccines have no side effects. They are perfect. They're the solution. Of course, vaccines have side effects. It may just be your arm gets sore. It may just be, you may run a low-grade fever, but validating that and saying, yes, I understand that you have some concerns about this, but here's what it's going to prevent. Here's the outcome we're trying to prevent. And I think that's like being honest about that and being, acknowledging, saying, well, when my child had XYZ vaccine, they were sick for 3 days. Okay, whether they were sick because of the vaccine or not, that is what someone will believe at that point, and validating that is their experience and that is something they have a reason to be concerned, and not make it as I am 1,000% convinced of the safety of the utility of vaccines, why they're so important. But I also know that there's real reasons for people to have some concerns, and validating that a lot of times puts you not in separate corners. It puts you in an environment of communication, of openness, of willingness to listen. Natalie, I think that's so important. Willingness to listen. I think a lot of times, as human beings, we come in, especially if we're passionate about something, we come in with, this is what I want to communicate. We need to get, I'm preaching to my own choir here. I need to get better at listening. And what are people actually saying? What are they concerned about? What are their fears? And how can we honestly have a conversation about that? It's not as much just about convincing. It's about building on the trust that is there, and then validating concerns and addressing the concerns from that point on, as opposed to, well, obviously vaccines are safe, so what are you waiting for?
Yeah, yeah, Natalie and Janine, thank you for that wonderful advice on, communicating about vaccinations. Antonio, did you have anything to add?
No, I think they said all what I had in mind. Thank you.
Yeah. Or Tamera, did?
No, ma'am.
Okay. Yeah, so I think, that this wonderful advice that we can use. I know that, we'll definitely need that in hopefully the near future as we communicate and, talk with those either that we work with at our organizations or family members and friends as well. It'll be really helpful. And I have one last question for you before we conclude. It is much harder, discussing complicated issues surrounding COVID with people we may know well or with whom we interact with more closely. So before we go, I wanted to ask, how can we communicate about COVID with someone whose beliefs are not grounded in science without further pushing them away? And when I ask this question, I mean, and I want to talk more about, people that are closer to us and maybe examples of, good friends or, good friends on Facebook or even loved ones or even healthcare professionals who, I've even noticed some healthcare professional friends of mine on Facebook who may not have all their beliefs quite grounded in science. So how do we communicate with those folks?
I can start with that, and I probably can say the same that Janine and Natalie mentioned for the vaccine. We cannot change the mind of people. We just need to listen. We need to listen. What are the reasons? What is the mindset of those people? What they don't believe on that. And I personally had a couple of conversations that we feel probably, and we have seen reaction for some people, but all depend how we can have that conversation. I ask probably 3, 4 people why they don't use mask, why they don't pay much attention for social distance. But we need to start a conversation in a very soft manner. Just try to understand what they have in their mind. We don't have to try to convince them, but we can leave with them some tools where they can take for them and be aware if that is a good thing for them, for the family, for the friends. And I had that conversation intentionally just to learn what they have in their mind. Um, as I said, just leave some tool. And I want probably to suggest tools that I use normally. We know the National Library of Medicine is the biggest sources that we have in the world. We can count with PubMed, and people don't know that. Today, we have very simple information. Probably 10, 15 years ago, we used to read that in a level that some people didn't understand much of the content. But today, we see that. And I am glad to help people saying you can read this because they can understand that simple information that is very helpful for the people.
I know for the work that we do here at the Health Hub, when communicating with someone whose beliefs are just not grounded in science, I often ask people what tools do you have? Like if you were dealing with a health professional who didn't necessarily subscribe to the belief that the novel coronavirus is as pervasive as it is and it has the effects that it may have. Often we would encourage our community members, empower them to push just a little bit to make sure that they're separating any science from ideology, that we also ask them to advocate for themselves to make sure that they understand, well, it has impacted me and my family in this way, and my community in this way. That may not be your experience, but how does this look like scientifically or within this realm, so that they can be their own best advocate when dealing with people who may or may not share the same values, but at the very least in their professional, in their profession, can definitely, hopefully, decipher between providing information that their colleagues as scientists are providing and not convoluting that with anything that's personal. So, and that goes for in the professional realm. When as far as your family, again, I would always go back to relationship building and understanding and being a lot more empathetic as to how and where that stems from, and then working through those kinds of things. But I could not agree anymore with Antonio about making sure at the very least you're there to listen and to learn about why that mindset is there, and then at the very least create or take from the tools and the resources that you have, to better not only understand, but to better equip yourself to have those difficult conversations in a more healthy and effective way moving forward. So.
I think another thing to tie into this is, and this is hard in today's environment, try to keep politics out of it. And that's, you know, it is just, that's really hard to do in the US right now because we're in an election year. But try to, so much of COVID has been politicized on all levels. So try to take a step back from that. And that is, it's one of the hardest things, I think, because things get, you know, we don't live in a vacuum. We don't argue in a vacuum. Our beliefs and our convictions, they blend with everything in our minds. But take a step back and really approach it from, what do we know about this virus? What do we know about the vaccine? And yeah, but like both Antonio and Natalie were saying, listen. If nothing else, listen, and be a safe place. Because if you're a safe place for someone to talk and to express their concerns, they may come back. They may not change anything they're thinking, but at some point they may have another question and they may come back and talk to you. And I think that is we need to keep our humanity more in sight. And I think that is something, I am a huge fan of digital media and social media. I use WhatsApp all the time because my family's in the Netherlands and that's my way to talking to them. But we have to keep in mind that there's human beings at the end of all this, and that our humanity is what we all have in common. And I think sometimes if we're just in front of a screen, which we're doing a lot of right now because social distancing, sometimes typing something takes that personal humanity connection, makes it tempting for that to take a bit of a back seat. Let's always keep remembering that whoever we're talking to, under whatever circumstances, whatever they may be struggling with, that they are human beings, and that shared humanity is ultimately what's going to get us through this.
Great. Well, thank you all. Those are the final questions that I had for you. But if there's anything that you'd like to add, anything that we didn't cover today that you think that we should add to this, please, feel free to let us know now.
Is it okay to do a shameless plug?
Absolutely. Go ahead, Natalie. That would be great.
I'll speak for the Health Hub. We are here. We are open. We're in the East End area of Churchill. Our phone number is 804-628-6401. Or you can email us at vcuhealthhub@vcu.edu. We really, really, really would love to hear from you. Our community health worker, who is Tamera, is absolutely phenomenal. If you want to connect with her, please do. She will navigate you to the best places and spaces, and she will stay with you until you ask her to leave. And so, and we have lots of great programs and opportunities. So we would love to connect with you and hear from you. And I'm sure Antonio has a shameless plug he would like to do himself. So.
Hi, Dina.
Yes.
I'm going to leave the phone number that we have for the community. That phone number has been very helpful for other organizations that we are partnering to do any activity in our community. Our phone number is at 978-673-6005. 978-673-6005. 6005. And we also take some messages through from different partners, sometimes through Messenger, Facebook. That's a way to be connected with us. Thank you. Anything that we can help, we will be reached at that number or through Facebook.
And Tamera, we had a request. Would you feel comfortable sharing a story about a time you made a connection in the community, like when that relationship building really worked?
Sure. Let's see. I make connections often, so this is like my everyday life. But I can say that, like, just basically being active in the community, like even walking down this street, going into the local neighborhoods, going into the local markets, and just saying hey and passing out flyers and like letting them know that I understand what they're going through. I hear their voice. I'm here to uplift them, and basically being a listening ear and a phone call away. In specific, let's see, I was in the market at 25th one day and I had my badge on, and a guy stopped me. He was like, what you do? Like, you work here in the market? I'm like, no, I actually work next door at VCU Health Hub. And he was like, what's that? And I'm like, okay. I gave him the whole spiel, like, well, one is an education center. This is this. He was like, what do you do? So I told him, like, I navigate people. I connect them to resources, connect them to basically anything to basically give them a better chance at a better quality of life. So he like, so you can help me do X, Y, and Z. I'm like, yes. He was like, what about my mom? I'm like, yes. So I gave him my business card at the time, and then I just walked away. Never thought nothing about it. I think like 2 weeks had passed. This was pre-COVID though. So like 2 weeks had passed, and a guy came in, and I can hear the front desk, I can hear the receptionist, I can hear people come in. He was like, I'm looking for a girl with long hair. I had her card. I met her in the market. So they was like, who? He was like, all I know is she can help me and my mom. I'm like, okay. So I stepped across, and I'm like, hey, and like we basically made a connection. I brought him to my section. We sat down, and that was pre-COVID. So I think that was probably in February. This guy had recommended me to like several people just by word of mouth, and me like connecting him to resources, and like everybody that I'm like dealing with now in the community, Wickham to be exact. It's crazy because they have their own community health worker, but I just randomly like ran into him at the store. But he has literally like people come in and say, hey, I met you. Well, I heard about you through so-and-so. He told me that you can do this for me, or you can do that. I'm like, yes. So basically just me walking through the market, like building that relationship, letting him know that I told him like, this is what I can do, and just following up and, doing whatever I can to make sure I stood in my word and fulfilled all his needs along with his mother as well as his sisters as well. So yes, definitely.
Oh, great. Tamera, that is so great to hear. I know it's always so wonderful when folks in the community recognize you and know that you're the person to go to. I remember back years ago, I used to work at a public library, and I would go out to eat at this little restaurant nearby, and they would always address me as library lady and ask me questions. And also it's always great to make those connections and know that community members, patients, or the people that we're working with can come to us. They know us as that person, whether the library person or community outreach worker, that they can ask us questions, for themselves or their family members as well. So that's a great story to hear. And I just want to thank you all so much for participating in this panel. I really appreciate, all the work that you're doing in the community. And I just want to say how just wonderful it is to know each of you and to have worked with each of you over the years and to know you. I just feel like we're a great team to work together. And I just feel like you're all so compassionate about what you do and you care so much for the community. And I just really just want to thank you all for that. And you're a great group of people to be jumping in with, COVID going on. I know, you're providing resources in the community, and it's just really great. So I just want to just really tell you all how much I really appreciate what you do. And I'm really honored to be friends with each of you and to work with each of you. And I'm also going to give a quick plug for the Health and Wellness Library as well. We're a library for patients and family members. Like I said, if anyone needs any type of health information, whether it be on any type of disease, condition, wellness, or about COVID, feel free to contact us. At the Health and Wellness Library, we're located in the Gateway Building of VCU Health ground floor, or you're welcome to give us a call at 804-828-2432. We're there to help answer any questions. So again, I want to thank everyone. I want to thank you all for attending today. I hope this discussion will help you as you communicate with others about COVID. Please feel free to place any comments you have in the discussion, and we won't have time to answer those today, but we'll respond to them soon. And I want to, again, thank you to the panelists for taking your time and sharing your thoughts about this important topic. And I want to, again, thank my co-facilitator, Oscar Keys. I know he's been working frantically behind the scenes, making sure everything went smoothly. To us, we feel like it did. I don't know what was going on back there, but I know Keys was taking care of it and making sure everything went smoothly. And also, I just want to say, Keys has been, we've been partners on this program from the start. He's helped contribute so much to this, his time helping develop these discussion questions and meeting diligently. So I just want to, give Keys that credit for all the great work that he's doing to bring this to you. And also want to thank VCU Libraries for giving us the opportunity to do this. This is just so important. So I want to thank VCU Libraries. I want to thank KJ Ricasata for helping us and supporting us in this as well. And also Gregory Kimbrell and Eric Johnson too, who helped us out kind of last minute today. So thank you all again. And thank you all for joining us. And I just wish everyone a wonderful day. So thank you.
I've turned my mic on. I'm so sorry. I messed it up right at the end. Just so everyone knows, we're going to be turning all these into smaller videos at the end. This conversation was something that we were really excited to bring together because we just couldn't find that information out there. I just want to give a quick plug to Dana's Misinformation on COVID guide. That's a VCU Libraries research object. We'll put the link in the description with that as well. But if you had a particular part of this talk that you really liked or wanted to share, we're going to be breaking them all up into smaller sections so they'll be easily shared. And I just also wanted to say a quick thank you, most definitely, to all of our panelists. It's been awesome to work with y'all, and thank you so much.
Thank you.
Thank you, Dina. Thank you, Oscar. Thank you for all you did to complete this today. Thank you very much.
Well, thank you all so much.